You wouldn't buy a car without a seatbelt, a laptop without Wi-Fi, or go a day without your cell phone. Could a business survive without the internet? Then why are many healthcare providers and provider organizations still not connected and enabled to share critical clinical information digitally in the care of your friends and family? Welcome to Kno2fy, a podcast from Kno2. Join host Dr. Peter Schoch, Chief Health Officer, and Therasa Bell, Founder, President, and CTO, as they bring the profound impact of healthcare communication to life through frank conversation in understandable language and through real-world context. They'll demystify interoperability, helping you unlock the potential of healthcare communication at scale. You'll also learn the transformative impact of being Kno2 connected. Connect, listen, transform.
Well, welcome back, everyone, to another episode of Kno2fy. We're going to talk a little bit today. We've been on the road quite a bit in the fall here, and we've had an opportunity to be at some trade shows and some user conferences. And Therasa, let's just talk a little bit about the most recent trade show that we went to was Health out in Las Vegas.
Yes, absolutely. As usual, I had the benefit of going for the last couple of years and seeing just how much it's grown. And first of all, that's what impressed me this year is just the significant expansion of the show and seeing the number of vendors and the vendors that have continued to push forward on their mission. And unfortunately, some vendors weren't there that were there in previous years. But
so, dude, it's funny because I'm a noob to the whole thing, right? So this is the first Health that I've gone to, and I've been to HIMSS, I've been to Vive, but this is the first Health I've gone to, and it was. It's Vegas, right? So it's kind of crazy anyway. In Vegas, there's a ton of people there, lots of other things going on. But I want to get to some of the things that you say stood out to you over previous years. I don't have any comparison. So the things that stood out to me was it was a pretty well attended conference. The layout of the conference was really good. And we had a setup where we got to sit down and meet a lot of folks and come through our meeting room. We didn't have a booth there this time, but we had a meeting room where we met with a lot of folks and got to meet with a lot of industry leaders in different novel areas in the industry. And that was a lot of fun. So I want to talk a little bit about what you thought, having been at multiple Healths, stood out to you this year.
yeah, I think what stood out to me this year is just the continued push into interoperability. You'd hope at some point that we would have maybe a break in it, but it just tells you the interest is continuing and people see it as the requirement for their business, being able to be connected. And they need it to survive as a digital health platform, whether you're an EHR vendor, software platform, hardware platform. It is definitely one of the primary topics that these vendors are looking for. So it was a great show for us, great discussions, and excited to see it become a meaningful part of everybody's stack.
Did you feel people they're understanding interoperability differently or better now than they have in years past? Is our understanding of what we need to accomplish maturing in the space at all?
Yeah, for sure. There's what I used to get for questions, even a couple of years back, and sometimes I still get them. But what I used to get for questions, people would confuse connectivity and would say connectivity at scale and interoperability at scale with like semantic interoperability and the need to start parsing apart data. And it was used kind of in a general term. And now people are starting to understand the various aspects of what interoperability means. And so when they spoke to us, there wasn't any conversation this year where I had to clarify what Kno2 did in terms of part of the equation.
That's true.
Did we have an interoperability? So that's been fun to watch the market educate themselves, at least this part of the healthcare market educate themselves and see how it's pushing forward.
It's funny because now that you mention that, I can see that was the case, but I don't know as I knew that was a difference in the moment. It just felt like there was a lot of conversation around what can we do with the data once we have it, it seems in the past. And what we're hearing now is, hey, that's all great conversation, but we first got to get it. And you guys are the ones that can get it for us is kind of the message I was seeing there.
Yeah, absolutely. We were stuck in that mode for, if I think back on it now, for about 10 years where we went all the way to the final mile of the discussion and never discussed what it would take to get the data.
Yeah.
And then finally, that's become part of the equation. Now, quickly, we'll find ourselves back to that final mile once we see the healthcare ecosystem connected. But it's really refreshing to not have to educate on that part and get to what does it take to get the data moving. And then people start to focus on what they need from the data.
It's funny because the final mile is where I want to spend a lot of time in my head, because that's the sexy stuff, right? That's the workflow stuff. That's how it's presented. That's the data enrichment. But you can't get there without first getting connected. And everybody wanted to bypass that, including us, right? We want to go right to the end point. And there are innumerable steps in the middle, the first one being connected, that need to happen before you can get to that other point.
Yeah, I like to call it the difference between data movement and data magic, right? That's the two parts of the equation. And data movement has to happen for data magic to happen. And again, both are important, critically important. Can't have one without the other, really. And you just have one before the other. So it is a chicken and egg scenario.
Yeah, it's interesting you said that, because I do think that's interesting to me, because we talk about impact of interoperability. In our last podcast, we talked about moving from the technical components to really the impact of interoperability, which is some of that data magic, right? But both are important. You have to have data and you have to have the magic.
Yep.
You can't have the magic without the data, and moving the data without the magic doesn't bring the impact that we talk about in interoperability.
It's really a 1 + 1 equals 3 scenario. It's truly that scenario.
Anything that stuck out in your head, Therasa, about any novel platforms or problems that tech companies were solving for that needed to get connected to the healthcare ecosystem to help solve that problem?
Well, it's been fascinating to watch. Technology, I would say, has largely stayed the same over the last couple of years, but there is a lot of shift to continued movement to the human, to the person. So, what can we do with the person? What's their engagement in the care cycle and care coordination?
I gotta laugh for just a second, because your use of the word human is such a tech word, right? I mean, we think, as a provider, I'm thinking of them as patients, which is also kind of a strange word. Consumers, persons, person-centered care, et cetera. I haven't heard anybody call it a human in a while in healthcare, but I love it. I love it. But you're saying
see technologists as humans, a bunch of us geeks running around. I just call it from the human stance. Just call.
But I like it. It's human as opposed to robot, which I like very, very much. And in tech, you just don't know. But so keep going with what you're saying, though. So you're saying that you're seeing a bigger trend toward the development of digital platforms that are trying to bring the patient or the consumer into the very center of their healthcare and their health information.
Yeah, and I wouldn't say that that's new by any stretch, right? We've seen and we've heard that talk for a few years now. But the maturation of these platforms, the reality of these platforms, 4 or 5 years ago, you saw a bunch of new platforms come on the market, and unfortunately, like I said, some of those vendors probably haven't made it. But those that have are really starting to see the maturation of their platform and find kind of level footing. And see where their application fits in the market. Now bringing data to that as we start to push into individual access and really start to see movement of that in TEFCA and QHIN. Really excited to see where these platforms evolve to.
Yeah, that's interesting too. As a physician, it was always strange to me, because there was a lot of desire on behalf of healthcare to give health records to individual patients or consumers. There wasn't as much demand on my end from my patients or consumers to have all of the data that we're talking about. There was some component of data that they wanted, and they wanted to have access when they needed it, mostly so that they could move it from one doctor or care setting to the other on behalf of themselves, because we weren't doing it for them. But I didn't have a whole lot of patients wanting to curate their entire repository of healthcare data on their own. Now, there are some really rational exceptions. When you're going through a complex illness, multiple physicians in the mix trying to make a complex diagnosis or pure diagnosis, there is absolutely a great need and a great cry for patients to have that information at their fingertips so that they can be the harbinger of that. But those are the minority in healthcare in comparison to the others. So it's really interesting where the landscape will take us when they do have more regular access to their care on demand, to their records on demand. Rather than longitudinally keeping a repository of it. Yeah. Anything else that stood out to you, particularly about either the vendors, the problems that vendors were trying to solve, or related to their platforms, or anything else there at Health?
I think that I didn't get a whole lot of time to spend on the floor, so I'd love to have spent more time just kind of talking to different vendors. And we've seen a lot of follow up from vendors from the show that are interested in connectivity. Most of the time, in fact, as you know, most of the time was spent in our meeting space, meeting with various vendors that had the needs. So I think that for me, that kind of summarizes what I saw on the floor, and and excited to see what next year holds.
Yeah, and again, I don't have anything to compare it to, but I do remember, when the conversations we did have in the room there in the meeting room, it would be expected that they would be more focused just because they had set up a meeting to talk with us and we were talking about something with them. But I did find that many of the folks we talked to were far more crystal clear about their use case for needing to get connected for the data, right? And that I found that interesting because I think the more crystal clear we are about a singular use case, the quicker we get connected and get the data moving. Man, you solve that one use case and it's bringing value in the segment it needs to bring value in. Then there's just interest generated, and I think adoption explodes at that point when people can actually see what it's doing around their major pain point, whatever that pain point is in their particular area of healthcare.
It's been tracking that against the kind of the maturation of our company and what we've seen in the market, and even pre-COVID. So let's go to 2017, 2018, 2019, and felt like we were really still pushing a rock up a hill in terms of just awareness, education, people understanding which part of the interoperability equation we solved, why that was at that time the most important part of the equation, and still is. And then as COVID hit, it became this accelerant to people's understanding, even though we've seen some decelerant from that, right? People have reverted back to old ways. But it came absolutely an accelerant to people getting educated and understanding the need to be able to be connected everywhere and have to do it at scale and really quick. So that absolutely changed the market dynamic. And then with every other market dynamic in the last couple of years, so we went from pushing a rock uphill to kind of normalizing out for a little bit to absolutely going downhill, trying to not be, totally roll over by the rock that's rolling on top of us. It's a great thing. It's a great problem to have. But it is a marked change, and it happened very fast in terms of the market shift and what we're seeing.
Really interesting point. Hey, when we come back, we'll take a quick break here. When we come back, I want to talk a little bit about the biggest problems in healthcare. That's one of the areas that you and I have talked a lot about, and something that we take a lot of pride in doing at Kno2fy is thoughtfully helping solve some of healthcare's biggest problems, and want to talk a little bit more about that in depth when we come back from break. So everybody sit tight. We'll be right back.
Hey everyone, my name is Matt Becker, VP of Interoperability at Kno2fy. I wanted to take a moment to introduce our connectivity report. Did you ever wonder who in your area you could connect with digitally and reduce the manual activities associated with clinical information exchange? Well, simply visit Kno2fy.com, click the link for connectivity report, then enter your name, email, and zip code, and we'll send you a report to show those providers and provider organizations already connected and waiting for you to join them. Take the first step to getting Kno2fy connected. It's free, takes less than 30 seconds, and will spark digital transformation that could revolutionize your business. There's even a how-to video to make sure you get the most from the report.
Connect, listen, transform. This is Kno2fy with your hosts, Dr. Peter Schoch and Therasa Bell.
Welcome back, everyone. We're here with Dr. Peter Schoch and Therasa Bell, as President, CTO, co-founder of the organization, just talking about the ethos of Kno2fy and some of the biggest things that we're tackling in healthcare. And it sounds like a pretty big question to ask, but you've been in healthcare a long time, Dr. Schoch, and have seen many, many different things.
You calling me old? Did I just hear you suddenly call me old?
I mean, like a one-room clinic, right? I mean, that's kind of like where you came from. Or maybe house visits, a little house in the crib. That's where you're.
Well, I did make house visits. I didn't do it in this country, but when I was in med school, I was over in the UK for a period of time and did some house calls over there. They still did that over there. So,
in your horse, is that how that worked? Did you have like the black doctor bag? Did you have the old doctor bag? Is that what you had?
When I graduated from medical school, my parents got me a black doctor's bag with my name on it. And the sad thing is, I'm going to say this for everybody. I can't believe I'm saying it, but my initials our PMS. And so I had a black doctor's bag, and I was carrying around a bag that had in gold emblazoned on it PMS, which at that time was meant something different probably than it does now. But so it was scarred for life. Just my parents tried to do something nice, and I got teased quite a bit about it. But,
well, I'm going to certainly bring that up in the future. That's not going to die here. But as we look at your eons of experience in this industry, tell us, being serious here, we're up against some pretty hard things in healthcare, and we see some very, very challenging things, probably more now than we've ever had, with all the progress we've made with technology and science. Give me your ideas as we look at what we're accomplishing with this company. What are some of the biggest challenges that you think we need to overcome in healthcare?
Yeah, boy, it is a loaded question. I'm happy to share just from my perspective what I see as some of the biggest problems in healthcare and why I think the ethos of this company is having an impact in those areas. And at first, some of these areas are big, big things. And you're going to think, boy, that seems so removed from a healthcare tech company doing interoperability. But hopefully I can draw a connection around where I see it connecting and having a real impact. So obviously the one that everybody talks about is cost, right? Total cost of care is out of control in this country. It used to be that pricing was the biggest driver of cost of care. Now, over the last couple of decades, it's moved into utilization, meaning we're doing more than we used to do. Some of that is necessary because as technology develops, we develop more treatments, more procedures that actually can help people. But there is a component of that that's probably not necessary. And I'll talk a little bit about those statistics. About 19%, almost 19% of our gross domestic product, which is every dollar generated by the U.S. economy, is spent on healthcare services. And there have been studies that have been repeatedly done over the last 3 decades that show about 33% of that spend is low value care, meaning that it has no bearing on diagnosis, treatment or management, prognosis, quality of life. So it's wasted care. It's care that didn't need to be done. And it's care that's wasting money, and there's an opportunity cost for that. So that's one of the big areas, cost. Another area is outcomes. You would think that if we spend that much on healthcare and we spend more per capita than any other westernized country in the world, that we ought to have excellent outcomes and we ought to be at the top of the page for every outcome. But we don't. We rank outside of the top 10 in a number of critical elements judged by the World Health Organization and other health organizations that judge the health of a healthcare system per se. So life expectancy, infant mortality rates, equitable access to care, things that you would think in this country, my gosh, we just shouldn't have a problem with those things, right? But we do. So we're spending a lot. We're not necessarily topping outcomes. So there's a mismatch there. So cost, outcomes, certainly. Certainly the patient experience of care, what it's like to be a patient in our healthcare system. I have an 85-year-old father, and I think many of us have parents or loved ones. I don't know how he would survive in the healthcare system without a healthcare professional in his family because it is incredibly complex. As you age and have more burden of disease, you end up seeing more doctors. The care gets more fragmented. Many of those doctors aren't in the same system. They don't talk to each other. They're not on the same records. I shouldn't say the doctors don't talk to each other. The healthcare records don't natively talk to each other in a meaningful way. So the patient experience, the fragmentation of care are two big areas as well. And then there's one that is obvious, I think, to a lot of folks lately, and that is the silver tsunami, they call it. This is the aging population as the baby boomers begin to age into Medicare over the next, continue to age into Medicare over the next 10 years in big numbers. And, I think I've said this before, you and I have talked about this before, but there's a study done that says from 2010 to about 2030, we're going to see some doublings in some important numbers. We're going to see Medicare beneficiaries double from about 33 million to about 66 million. We're going to see the cost per beneficiary on average go from about 125 to about 225, 250 to care for those folks on an annual basis. So doubling of the number of people, doubling of the cost. We're going to see the disease burden not quite double, but go from about 1.4 chronic illnesses per beneficiary to something over 2, like 2.1, 2.2 chronic diseases per beneficiary, largely led by obesity and diabetes, two metabolic and epidemic problems in our nation's health. And then we're going to see the life expectancy of each one of those Medicare members on average go up by about 1.2 years. So more people in Medicare, more people, greater cost to take care of each of those folks on average, partly because of the greater disease burden and the new treatments and everything else, the meds and everything else to treat it. And then they're going to live a year longer. So all of a sudden, when you think about that, and Medicare being the biggest purchaser in this country of healthcare, and self-funded employers being the second largest purchaser of healthcare in this country, we have a problem, a looming crisis that we need to deal with, especially if 33% of what we're spending could potentially be avoided because it's not helpful in improving health outcomes. The last thing, too, that I think, and these are just 5 of my big ones. There are other ones, but I think there's some derivative of these. The next one to me is really around the provider shortages. And this isn't just in doctors. And it's not every specialty, but there are critical shortages in key specialties throughout the country. I know that there aren't enough primary care doctors graduating from residency programs to fill the gap or fill the need for primary care doctors in the country. That means we're using ARNPs and physician assistants, and that's fine. And we can use them in those training. But every time we do that, we're pulling somebody off the floor at the hospital, a nurse off the floor at the hospital that now is an advanced practitioner nurse. So, and then you go down below those types of providers to MAs, to nurses, to staff that work in a doctor's office. And there are shortages there, and the pandemic made that worse. And then two other things that I think are derivatives of this, but I'll pause for a minute. But healthcare operations for healthcare businesses are operating on razor thin margins, where reimbursement in attempt to control cost, right? Reimbursement is going down or harder to keep at its current levels, whether it be from the government through value-based purchasing, whether it be self-funded employers not wanting to pay as much and looking at their bottom line. And expenses to keep staff to deliver care have gone up significantly. And so margins are getting thinner and thinner and thinner. And nowhere is that more important than in the spaces that you and Kno2 and we have really largely focused on for interoperability over the last 10 years in the post-acute spaces. And that's important when you think about it, because the post-acute spaces are generally filled with people over the age 65 who tend to need more of those services, and we're increasing that population. So those are 5 or 6 of the kind of the big problems in healthcare. So I'm going to pause there. I won't list a number of others. There are others we can talk about, but they all have in common one important thing, in my opinion, and that's where it comes back to what we're trying to do with interoperability, Trace, and that is all of those can be impacted in a positive way by the democratization and free flow of clinical information at the point of care, by people getting connected and letting the information flow. Now, to your point, that's movement. The magic has to happen as well. But first get the data moving. And I learned that from you. First get the data moving. That's why it's so exciting to be in this business as a provider, because it's critical to solving some of those big problems. I don't know how we do it without it, to be honest. I don't know how we do it without it.
Well, I think those are really, one, I'll have to just give you kind of my immediate response to hearing those challenges. I feel like we're way behind, right, in terms of connectivity, but we've got to move fast. I do get a little bit of anxiety saying, oh man, we got a lot to get done. But at the same time, it really drives a lot of purpose back into into the organization with the ethos of what we're trying to get accomplished. And I think each one of those would be a great discussion point for a future podcast, just to discuss how can we impact it, how can we do it quickly, effectively, and what kind of measurable return could we expect from seeing connectivity in each one of those settings.
Yeah, I love that. I love that. I agree with you. I think each one deserves a conversation of their own. I think it's to your point, though, about making it important, making it impactful to the people who are doing the work of connectivity. One of the things that I was enamored by with the tech org was the thoughtfulness, the talent, the commitment of the people working behind the scenes to do this, but yet the disconnection from what it actually meant that they were doing, right? I mean, it's cool to solve a problem and say, okay, this code works well like it should, and that's great, and see something built there. But then when we talk to them about what that really meant and what that could really drive in the end and how that could have an impact in their society, for their family, for their loved ones, man, that's powerful, really powerful.
Yeah, I totally agree. And it's watching, our engineers be able to see that outcome, one, how it affects just the pride that they have in their work, but also the impact to their very family. They know the impact, and seeing that opportunity. And I would say that one of the other big challenges that we have in connectivity is we've put in a lot of foundational work. There's been a lot of money, a lot of the High Tech Act, a lot of the stimulus funds have gone into the foundational work, but there's still some friction points in it that have prevented it from working at scale. And we are absolutely tackling those as a company to allow us to start seeing this really become a flywheel of data flowing, and excited to see what that carries for us moving forward also.
No, I think that's I have to be honest, from an outsider coming into Kno2, it was interesting to me because it is kind of guerrilla warfare to do that, right? I mean, you have to really dig into it, understand what's going on at a granular level to be able to get at some of those things. And seeing that happen has been pretty powerful. So we're going to take a quick break. We'll come back. We'll wrap up. And we would be remiss, Theresa, if we didn't talk about one of the things. So in addition to health, we've gone to a number of different user conferences across the post-acute space over the last 8 weeks. Really enjoyed meeting a lot of end users, a lot of people committed to the work they're doing and looking for help doing that work and making it easier to do that work, which I think we're going to end up providing ourselves and a lot of other folks, but through that connectivity piece. But one of the things that was on their mind kept coming up was TEFCA QHIN. And I know there's a lot in that. We'll come back, spend about 5 minutes, talk about that as we wrap up today. So we'll take a quick break, be right back.
Hey, Maddie, what's going on? How can I help you today?
I think my allergies are acting up. I've had a runny nose for a few days now, and my eyes are itching, but I don't have a fever or any other symptoms.
Okay, well, honestly, after examining your symptoms and examining you, I think you're in great health. And I think your allergies may just be acting up, but honestly, some allergy medication should really just do the trick.
Yeah, that would be great. Thank you.
Of course, let me take a quick look at your chart just to confirm your meds and your allergies, and then I can get that sent to your pharmacy for you electronically. That way you can pick it up on your way home.
Okay, thank you.
No problem. Maddie, I see from your chart here that you went to urgent care 3 months ago for a similar complaint, and they thought you may have had a sinus infection and gave you an antibiotic and a decongestant.
Oh, yeah, that's right. I totally forgot to tell you about that. I was at the beach with my family. Wait, how are you able to see that?
I can see that because our EHR is actually Kno2 connected. So what that means is that we can share clinical information with other providers electronically and automatically. So essentially, no matter where you go, I'll have line of sight into your care, and I can also send your records electronically to others if they need them while they're caring for you.
Oh, wow, that's amazing. I've never heard of anything like that before, but it's great to know that you're looking out for me no matter where I go.
Of course, we have the ability to connect with anyone, so it helps us make better clinical decisions and truly just keep our patients safe. So, in your case, the records I received indicated an allergic reaction to the antibiotic. Do you remember that?
Yeah, I do now. I broke out into a rash and had to go back for additional evaluation and treatment. But it was really painful. I was itchy all over, and I wasn't able to get any of my work done throughout the day.
Yeah, I can imagine. Let me do this for you. I'm going to include that allergy in my chart here. That way, your record is up to date and complete, and it will avoid anyone giving you that same medication going forward.
That would be great. Sorry, I totally forgot to mention that.
No, it's okay. Don't apologize. It happens all the time. We're all busy and we just honestly forget stuff.
Yeah, you're right. Thank you.
No problem. And trust me when I say we have your back because we're Kno2 connected. You're safer. We can see all of your care even when you can't remember it.
Connect, listen, transform. This is Kno2fy with your hosts, Dr. Peter Schoch and Theresa Bell.
Well, welcome back, everybody. We want to close out our episode talking about the most recent conference we were at, and then TEFCA QHIN. The most recent conference we were at was what we call NAC, NAHC. Theresa, what does that acronym stand for?
That's the National Association for Home Care and Hospice. It's one of there's like 3 or 4 big trade shows representing the post-acute space, and that's one of them.
Gotcha. So we were there, had a booth presence there, and had an opportunity to talk to a lot of folks. What stood out to you about that conference, and how did that differ from the health experience that we had?
Well, first of all, I mean, it's obviously notably smaller, although for its industry that we're representing, it's actually the largest it's been. So that was good to see, but noticeably smaller in terms of size and just representation by vendors, right? You do and it's no disrespect to that industry, but it's been an industry that's lagged for a long time post-acute, but it's accelerating, and that's exciting to see, meaning it's closing the gap with what I call mainstream healthcare. But for
you say smaller, and I think more intimate in that sense, meaning that and I think one of the things you pointed out that I want to emphasize is that it's growing year over year, which is really important because the post-acute industry is rising in importance as more and more folks age into Medicare, and the use of post-acute services really expanded to mean everything outside the hospital is going to be greater and greater and greater, and new care models in the home are going to be developed. So it was interesting to see that it's continuing to grow and take on emphasis or more membership.
Well, I think it was, even though that's not what I meant by the word smaller, I liked how you referenced to more intimate. And quite honestly, I hope that industry never loses that. Pretty hard not to when it's going to go past that, because I would not use that word in defining health. I would not say intimate, in not that negatively speaking, but it's not an intimate setting. There's just enough there's enough coverage of vendors and so forth that you just can't have that. But it still exists in the post-acute space, and there's a lot of close-knit family, you know what I mean? And I hope it never goes away.
When I say intimate, I hope it doesn't go away either. When I say intimate too, I'm thinking of and that may not be the right word either, but it's less frenetic than those big shows like HIMSS, Vive, and Health, right? Where there's just so much coming at you, so much going on. It almost seems like it's a real dichotomy, because it's a great stimulus to see everything that's going on across healthcare and all the innovation in tech and all the problems that are trying to be solved. And then it's also nice to get in a room where there's real focus around care settings and talk specifically about some very big but common issues at a conference like NAC.
Yeah, I think it's for me, being able to be in a setting like that and watch, one, an industry change and grow, but two, a significant difference between the NAC show and just the industry and what we're seeing at health is there's a lot of education still to be done. And they're the most educated they've ever been. So again, no disrespect, but there's a lot yet left to do. And I take that as a personal responsibility for our organization to be educating folks there on what the opportunities are, all the hard work. And I always use this reference, but all the money that went in, all the stimulus dollars that went into building interoperability in the infrastructure, even though they didn't receive the money, they can ride the tailwind of it. And I don't want that ever to be lost, because I often hear, well, we didn't get any money, so, thus we're never going to be able to make progress. That's just absolutely not true. And there is infrastructure to be able to hitch their wagons to. We're absolutely the loudest voice in being able to smooth out any of the rough edges that are still left, especially as it relates to post-acute. But they have to participate. And that's my goal over the next 12 to 18 months, to get as much participation from this community, which will move the whole industry forward and put everybody on a level playing field.
Yeah, I love that. It's kind of like the interstate highway has been built, and now we need to build on-ramps to the specific areas in the post-acute space or historically post-acute space. The other thing that I think it comes to mind when you say those things, which is really music to my ears, because, having been a primary care physician for 20 years, having worked in health systems, leading population health, trying to knit an entire ecosystem together to control cost, quality, and patient experience, and having led post-acute entities, home care, hospice, and seeing the challenges they faced. Home care has always been the unwanted stepchild, or the red-headed stepchild, if you will. I don't know if you can even say that anymore, but it's always been the second-class citizen. It's always been the second-class citizen to the general healthcare ecosystem, right? It's been a passive receiver of discharges from hospitals and health systems, and served that purpose very, very well. But man, there's a whole world opening up for the traditional post-acute space that I think is really exciting to see. And some of that includes new innovative home-based care models, platforms being developed to deliver care in those settings, and virtual care that all need connectivity as we move through it. And that's what I love about seeing a conference like NAC focused on a particular part of the industry and particular care models.
Yeah, in fact, as you know, we're going into another senior living conference here in a couple of weeks. And I'm excited for that one, because that's completely new thought leadership and completely new care models as it relates to planned communities. And I can't wait to talk about that one. But there are
Yeah.
so many different opportunities, both what's already been kind of conceived, I think, through value-based care, but also things that haven't been conceived or not included in that value-based care thought process today that absolutely need to be brought into the fold as we reinvent how care is being delivered. Just super excited for it. And I'm excited to sit right in the middle of it because that's what connectivity is, and being able to affect change that way.
Yeah, and you mentioned the one that's coming up. I really agree with all that. And you mentioned the conference is coming up. I have the privilege of being able to speak at that conference. And I think one of the topics of our next podcast, we can talk a little bit about that because it is what you're talking about. How do we use senior living in different ways, and how does senior living become more relevant in the healthcare space? They've got a captive audience. They've been doing that work for years. And I think there's some real innovative ways that they can begin thinking about how they break into the healthcare space in different areas. So look forward to that. One of the things that came up to me so many times, not only at Health, but a number of our other user conferences, and certainly at NAC, amongst post-acute partners, home care agencies, hospice agencies, but also platform partners and platforms out there, meaning digital health platforms, meaning population health platforms, patient engagement platforms, remote patient monitoring platforms, et cetera, all who need to get connected to the ecosystem. And one of the questions that they had was around TEFCA QHIN. You know, this big announcement where Kno2fy was one of the applicant QHINs, one of the 6 applicant QHINs that were approved in February of last year at a big ceremony at the ONC. There were a number of others, 5 others that were part of that initial class of applicant QHINs. And all of them are going through the process now to go live sometime after the first of the year, as scheduled by that process. Can you talk just a little bit about that, Therasa, as we close out today, TEFCA QHIN? I think we're going to have a podcast that's probably dedicated to a conversation in total about that because there's so much there, especially as you've talked about it. But maybe demystify what TEFCA is, QHIN is, and give us kind of a teaser of what we can talk about maybe in our next episode.
Yeah, at TEFCA, I mean, if for those that have tracked some of the previous networks that have been put in place, there's always what they call a trust framework. And in essence, that what that is just kind of I won't call it a peace treaty, especially right now, but I'll use it as a reference to say it's kind of a rules of the road that vendors agree to say that we're going to enforce these not only on our own infrastructure, but anybody that attaches to our network. We're going to make sure that they're following rules of the road to protect the patient's information for the security, but also for the providers and everybody else involved. And in some degree, that there's protection for business models in there too, to make sure that even though at the end of the day we want healthcare to be, altruistic, we are running businesses, and that needs to be protected, right? So you have this trust framework. There's as much of a technical component to that. There's actually a certificate that gets shared. It's kind of a secret handshake, if you will, between the vendors that say, when I come knocking at your door, here's my secret handshake, let me in. But also this rules of the road. So we have a trust framework. That's what TEFCA stands for, the Trusted Exchange Common Framework. And then QHIN is the actual network infrastructure underneath. So QHIN is a Qualified Health Information Network. And there is a technical framework called the QTF that defines how that QHIN is built and what transactions they have to recognize on that QHIN. So just like a mobile vendor will recognize incoming calls, outgoing calls, they'll recognize SMS messaging. Those are all technical protocols that sit behind the scenes.
Gotcha.
For QHINs, they have a QTF, and we've all agreed to implement the QTF so we can talk to each other. Just like an AT&T can talk to a Verizon, can talk to a T-Mobile, any of them can talk to each other because they're using the same protocols for communication. That's what's happening. So Kno2fy, one of the currently 6 named QHINs, applicant QHINs, as you brought out, that hoping to go live here moving into the beginning of the year, where, of course, we're going to have a little bit of a slow ramp into it. But the goal is that this becomes I always say that third time's a charm. And this is really kind of our third time around, but it's not net new. So we're taking learnings, taking technical protocols from previous work, including care quality, very, very successful network. So we're taking all of that in and really pushing into a broader network, national network infrastructure that can really be used as the genesis for net new innovation and we're not getting stuck up in the technology or stuck in the technology as the technical framework is defined. We're innovating on it and allowing things to actually occur. So excited for it. Super excited.
So, Tracy, you brought up an analogy that I want to see if I can take further, just the dumb provider in me from a technical perspective. So we've got these kind of policies and procedures, which is the trusted exchange framework and common agreement that says this is how we're going to behave so that we protect information, protect one another's business interests, et cetera. And then there is the technical framework and network, meaning the people, the nodes, the people who are exchanging the information that sit beneath that, and that's the QHIN, the Qualified Health Information Network. So policies, procedures, rules of the road, technical framework that allows for broad-based exchange. And just like you were using you said the third time's a charm, it's interesting because I was thinking you would use the cellular carriers as a metaphor for this. Well, just like there was, 3G, LTE, 5G, 5GE, I would imagine we're going to continue to iterate on our network technical infrastructure to make sure that we're providing the best, fastest opportunities for exchange, right? And most complete opportunities for exchange. So it doesn't surprise me that we've had iterations of this and may have iterations beyond QHIN.
I hope so. Meaning, I hope.
Or iterations of the QHIN structure.
That's right. That's right. The goal would be that QHIN is we're just getting started with the current QTF. I do believe this QTF is the chance that FHIR will actually have to be realized. I mean, FHIR is now almost 12 years old, and it's still the rage, and it's really anemic in terms of actual usage because it's not done at scale. There's not a trust framework. There's not an agreement among vendors to do it at scale that they can share information. I believe QHIN and QTF will absolutely we'll see that come to reality, and that will deprecate some of the old ways of us sharing information that were just heavier because technology's improved. And now we have some of these new ways that are lighter weight, and who knows what the future holds. We're just getting started here, but we have to have a baseline to get started, and we'll see where this takes us.
Yeah, the other thing that you and I have talked about, I really appreciate the explanation. You have made something that was very complex for me to understand coming into technology as a provider, pretty simple to understand based upon the way you've talked about it. And I really appreciate that. And I think our audience will too. As I think about the way we at Kno2 look at QHIN, and I think you've shared that a little bit. I don't know if you're willing to share that or not, but I think we looking at it, you've talked about it kind of looking at it as it can be a separate thing, but it doesn't have to be a separate thing. It's just another network that we're going to continue to build to so that anybody on our network has is future proof, so to speak. I'm not saying that as well as you've said that to me in the past.
Yeah, I mean, it's unlike other industries, we can't start something new in healthcare. It's got to be additive. And we've attempted, because healthcare is so hard and complex, we've attempted multiple networks. And like I said, care quality is an evidence of success, right? So it's capable, we can do it. We can share information. But QHIN services, if we were going to go all in and only in on QHIN, one, we wouldn't be in business a year from now because it's certainly not going to take off the way that it just won't. That's not healthcare. Yeah. But it needs to be additive because you can't place your bet on one single thing. In healthcare, there's just too much complexity. Just the definition, you ask anybody what healthcare means. Some say, well, hospitals, some say docs, some healthcare is so wide in its definition alone that you just can't bank on one. So Kno2, our whole premise is one API. We have you future proofed. We'll connect you everywhere. I mean, who knows? Maybe the next administration has some view on some net new protocol and network. Okay, we'll take a look at it and we'll push into it. We're going to attempt to make these as successful as we can. We're not a bandwagon company either. So there's been plenty of things we've said no to that I think we made some pretty good decisions because those things have not come to fruition. So feeling good about this one and looking forward to the future.
Well, I really appreciate that. The other thing that I'll just close with, Therasa, is allow you to say this to the audience, because I think it's one of the things that sets us apart and that we really enjoy, and that I think is really helping to lead to broader adoption of interoperability. And that's, we'll remove the complexity of all the technology behind the scenes to communicate when you connect through us, so that you don't have to worry about it and you can focus EHR vendor, technology partner, end user on the things that make the magic. You let us worry about moving the data, and you worry about making magic with the data once it's in your system where you have access to it. Is that a fair statement?
Oh, for sure. I'll finish with this, kind of thought. I get asked frequently to be on panels, and one of the questions that comes up almost every time that I have to just scratch it from the list is, as an end user in the audience, they want to pose the question of what do they need to think about as when they're thinking about TEFCA and QHIN.
Yeah. Actually, I heard that one of our end user conferences this fall, actually. Yeah.
Yeah. My answer is hopefully nothing. Because if you're having to think about it as an end user or a provider, I'm not doing my job. And that tells me, because I don't think about my mobile carrier when I make a phone call, right? I'm not thinking about, man, what protocol is this going through on and what's happening here? I'm not. Yeah. I'm hoping that call goes through for sure. Yeah. That's my expectation, but there's no more thought to it than that. And
well, to take that even further, Tracy, you don't think about it until it doesn't work, right? Until you don't have coverage, and then you think about it, right? So the goal is to make it work all the time if we can, so that people aren't thinking about it. So wonderful. I would love to come back and in one of our future episodes, just dedicate something to QHIN, TEFCA, and the roadmap and a broader understanding. There's more detail here that some of our listeners would be interested in, that I think you can provide, that I think hopefully can, through education and an understanding of what it really is, calm some of the fears and help people make rational decisions around what they need to do in the QHIN world coming up in January 2024 and beyond. So we'll end it there today, but thank you so much, everyone, for listening in. We hope to see you on the next episode of Kno2fy.
Thanks for joining us today. That's a wrap for this episode. Please subscribe or follow on your favorite podcast platform to make sure you don't miss an episode. Get Kno2 connected today and set yourself and your organization free to unlock your potential. For more information on the value of being Kno2 connected, visit us at www.kno2.com. Follow us on LinkedIn or Twitter. Connect, listen, transform.